This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am Valsa Williams and with me is Renuka. The headlines. Prime Minister Narendra Modi reviews countrywide preparedness to deal with COVID-19, directs officials to ensure sufficient availability of essential medical equipment. Prime Minister holds telephonic conversation with US President Donald Trump. Two leaders agree to deploy full strength of India-US partnership to fight novel coronavirus. Government releases first installment of 11,092 crore rupees under State Disaster Response Fund to combat COVID-19. Health Minister Dr. Harshvardhan urges people not to create hindrances in duties performed by healthcare professionals. And Power Ministry clarifies adequate arrangements in place to handle grid stability during Lights Out event tomorrow. Prime Minister Narendra Modi today chaired a joint meeting of the empowered groups constituted for planning and ensuring implementation of COVID-19 response activities in the country. He reviewed the countrywide preparedness regarding availability of hospitals, proper isolation and quarantine facilities, as well as disease surveillance, testing and critical care training. The Prime Minister also directed the concerned groups and officials to ensure sufficient production, procurement and availability of all essential medical equipment such as personal protective equipment, PPEs, masks, gloves and ventilators.
Prime Minister Narendra Modi today had an extensive telephonic conversation with the US President Donald Trump. In a tweet, Mr. Modi said they had good discussion and agreed to deploy the full strength of India-US partnership to fight COVID-19.
601 fresh confirmed cases of novel coronavirus or COVID-19 have been reported in the country during the last 24 hours, taking the total number to 2,902. Out of the total cases, 183 patients have been discharged from hospitals after recovering from the virus, while 68 patients have lost their lives. This was stated by Joint Secretary, Ministry of Health and Family Welfare, Love Agarwal, while briefing media in New Delhi today.
अब तक भारत में टोटल 2,902 पॉजिटिव केसेस पाए गए हैं, 2,902 पॉजिटिव केसेस पाए गए हैं और अगर कल में देखें तो अराउंड 601 पॉजिटिव एडिशनल केसेस पाए गए हैं. टोटल 68 डेथ रिपोर्ट हुई हैं, जिसमें से 12 डेथ येस्टरडे यानी कि कल रिपोर्ट हुई हैं. 183 पीपल हैव आल्सो रिकवर्ड और वो डिस्चार्ज हो चुके हैं.
Mr. Agarwal said the cases reported in the country are much lesser than those detected in other countries.
अगर हम देखें तो हमारे देश में जो केसेस का डबलिंग रेट है वो बाकी अधिकांश देशों के मुकाबले काफी कम है. लेकिन इसके साथ ही जो एक मुख्य इश्यू फिर मैं आप सबकी दृष्टि में लाना चाहूंगा कि हम एक कम्युनिकेबल डिजीज, एक इन्फेक्शियस डिजीज से डील कर रहे हैं. हमारी हर दिन की बैटल है. हम आज अगर सक्सेसफुल हैं, कल अगर कहीं पर भी कोई भी चूक होती है तो हम फिर से पुरानी परिस्थिति में आ सकते हैं, फिर से हम सक्सेस से नॉट सक्सेसफुल की कैटेगरी में आ सकते हैं.
The Joint Secretary said 9% cases are of the age group between 0 to 20 years, 42% cases have been detected in the age group between 21 to 40 years, while 33% cases are related to patients between 41 to 60 years of age. Persons above 60 years of age make 17% of the total cases. Mr. Agarwal suggested to the high-risk people to follow the directives and guidelines issued by the government. He also informed that 1,023 positive cases of COVID-19 have been identified from 17 states including Tamil Nadu, Rajasthan, Delhi, Telangana, Jammu and Kashmir and Assam, Jharkhand and Karnataka, which are linked to the Tablighi Jamaat cluster.
तबलीगी जमात से रिलेटेड केसेस हमें 17 स्टेट से मिले हैं. उसमें 1023 पॉजिटिव केसेस जो कि इससे लिंक पाए गए हैं एपिडेमियोलॉजिकली. अब तक हमारे देश में जो टोटल केस आए हैं उसमें से करीब 30% केस, 30% केसेस आर लिंक टू वन पर्टिकुलर प्लेस वेयर वी कुड नॉट सॉर्ट ऑफ अंडरस्टैंड इट एंड मैनेज इट.
Mr. Agarwal said states are being provided with all kinds of logistics including masks and PPEs. He said to fight the menace of COVID-19, it is very important that the guidelines related to lockdown and social distancing, as well as the advisories of respiratory and hand hygiene measures, are followed at all levels. Joint Secretary in the Home Ministry, Punya Salila Srivastava, said that the lockdown measures are being effectively implemented. She said the availability of essential goods and items are satisfactory. The first installment of 11,092 crore rupees under the State Disaster Response Fund was released yesterday on cases related to Tablighi Jamaat workers. Ms. Srivastava said through a massive effort, around 22,000 Tablighi Jamaat workers and their contacts have been quarantined.
एक मैसिव एफर्ट के थ्रू लगभग 22,000 वर्कर्स और उनके कॉन्टैक्ट्स को आज की डेट में क्वारंटाइन कर दिया गया है.
Union Health and Family Welfare Minister Dr. Harshvardhan today visited the Lok Nayak Jayaprakash Narayan Hospital in New Delhi to assess the preparedness to deal with the COVID-19 pandemic. Yesterday, the minister had visited Ram Manohar Lohia and Safdarjung hospitals to take the stock of the arrangements made to tackle the COVID-19 cases. He praised the efforts of doctors, nurses, hospital management and sanitation staff, saying that they are working tirelessly to provide urgent relief to the patients. Dr. Harshvardhan expressed concern over misbehavior with the healthcare professionals and urged people not to create hindrances in the duties performed by these healthcare professionals.
कल निर्णय लिया है कि एनएसए के कानून के अंतर्गत ऐसे लोग जो हमारे डॉक्टर्स को या हमारे हेल्थ सिस्टम के साथियों को जो कि कोरोना वायरस वॉरियर्स की तरह काम कर रहे हैं, अगर कोई भी टारगेट करेगा तो उसके खिलाफ सख्त से सख्त कानून इस्तेमाल किया जाएगा. इसका देश के गृह मंत्रालय ने एक बहुत बड़ा मैसेज दिया है और मेरा देश में समाज के लोगों से ये अपील है कि आप किसी भी रूप में जो लोग आपके प्राणों की रक्षा के लिए दिन रात काम कर रहे हैं उनका सम्मान करिए, उनके साथ कोऑपरेट करिए.
Health Minister Dr. Harshvardhan today said that more than 50 crore poor and vulnerable citizens will be eligible for free COVID-19 testing and treatment under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana PMJAY. In a tweet, Dr. Vardhan said that testing at private labs and treatment in designated hospitals has now been made free for Ayushman beneficiaries across the country. He said the private sector should act as a key partner in the fight against COVID-19 infection. Dr. Vardhan appealed to the private labs and hospitals to come forward in large numbers to become a part of this effort.
This is All India Radio bringing you a special program on COVID-19. A reminder of the headlines before we move on. Prime Minister Narendra Modi reviews countrywide preparedness to deal with COVID-19, directs officials to ensure sufficient availability of essential medical equipment. Prime Minister holds telephonic conversation with US President Donald Trump. Two leaders agree to deploy full strength of India-US partnership to fight novel coronavirus. Government releases first installment of 11,092 crore rupees under State Disaster Response Fund to combat COVID-19. Health Minister Dr. Harshvardhan urges people not to create hindrances in duties performed by healthcare professionals. And Power Ministry clarifies adequate arrangements in place to handle grid stability during Lights Out event tomorrow. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
गांवों के सरपंचों के लिए कोरोना वायरस कोविड-19 से जुड़ी एक आवश्यक सूचना. दूसरे राज्यों और शहरों से वापस आए लोगों को कोविड-19 के बारे में ये जानकारी अवश्य दें. आपस में 1 मीटर की दूरी बनाए रखें. नाक, मुंह या आंखें अनावश्यक न छुएं. बार बार हाथ साबुन से अच्छी तरह 20 सेकंड तक धोएं. खांसते एवं छींकते समय रुमाल या कोहनी से नाक मुंह ढकें. कोविड-19 से बचाव के लिए आशा कर्मियों से सलाह लें. अधिक जानकारी के लिए अपने जिला मजिस्ट्रेट या मुख्य जिला चिकित्सा अधिकारी से संपर्क करें या भारत सरकार के हेल्पलाइन नंबर 1075 पर कॉल करें.
Prime Minister Narendra Modi has said that India is united in defeating COVID-19 and this unity will be manifested tomorrow evening. Mr. Modi in a tweet said that these 9 minutes at 9 p.m. tomorrow will bring our nation closer and strengthen the battle against COVID-19. Mr. Modi said the role of media is very important in the fight against COVID-19. In a video message yesterday, the Prime Minister had urged countrymen to switch off lights of their homes tomorrow at 9 p.m. for 9 minutes and light up diyas, candles or mobile flashlights to display the nation's collective spirit to defeat coronavirus. The Prime Minister said the country has to move towards light from the darkness created by coronavirus.
5 अप्रैल रविवार को रात 9 बजे घर की सभी लाइटें बंद करके घर के दरवाजे पर या बालकनी में खड़े रहकर 9 मिनट के लिए मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट जलाएं और उस समय यदि घर की सभी लाइटें बंद करेंगे, चारों तरफ जब हर व्यक्ति एक एक दिया जलाएगा, तब प्रकाश की उस महाशक्ति का एहसास होगा जिसमें एक ही मकसद से हम सब लड़ रहे हैं, ये उजागर होगा.
The Prime Minister said people should maintain social distancing, stay indoors and not form groups while lighting up the lamps. He said people displayed unprecedented discipline and sense of service during the ongoing nationwide coronavirus lockdown. Citizens are advised not to use alcohol-based sanitizers while lighting diyas and candles tomorrow at 9 p.m. as it is inflammable.
Ministry of Power has clarified that adequate arrangements and protocols are in place to handle grid stability during Lights Out event tomorrow at 9 p.m. The clarification came in wake of the apprehensions that switching off lights during the period may cause instability in the grid and fluctuation in voltage, which may harm the electrical appliances. The Power Ministry said these apprehensions are misplaced. The ministry said the Indian electricity grid is robust and stable. The statement said the appeal of the Prime Minister is to simply switch off the lights in their homes from 9 p.m. to 9 p.m. tomorrow, and there is no call to switch off either street lights or appliances like computers, TVs, fans, refrigerators and ACs in their homes. Only lights should be switched off. The Power Ministry said lights in hospitals and all other essential services like public utilities, municipal services, offices, police stations and manufacturing facilities will remain on. The ministry has advised all local bodies to keep the street lights on for public safety.
The Civil Aviation Ministry is undertaking continuous efforts at policy level and ground level to add substantially in the country's fight against novel coronavirus. The cargo delivered to various parts of the country include COVID-19 related reagents, enzymes, medical equipment, testing kits and personal protective equipment, PPE, masks, gloves and other accessories requisitioned by states and union territories. Hub and spoke lifeline services have been started so that different and distant parts of the country can simultaneously be catered to and resources are utilized optimally. An air bridge between Shanghai and Delhi has been established. Air India will be operating dedicated scheduled cargo flights to China for uplifting of critical medical equipment. More from our correspondent.
Domestic cargo flights are playing a crucial role in strengthening India's fight against COVID-19. Medical supplies, including testing kits, masks, gloves, and other equipments are being delivered across the country since 26th of March. Medical supplies are also being delivered in northeastern region of the country so that no region is left behind in the fight against coronavirus. Besides, a dedicated medical air cargo-related website, Lifeline Udan, has been launched and is functional. The link is available on the website of the Civil Aviation Ministry. Around 139 tons cargo load were carried by the cargo flight so far since 26th of March. Anand Kumar, AIR News, Delhi.
Here is a positive news on COVID-19 front. The number of patients who have been discharged from the hospitals after recovering are picking up. Our correspondent spoke to Ajit Mishra, who was discharged from the Safdarjung Hospital today after recovery from the COVID-19 infection. Mr. Mishra advised the people not to panic due to novel coronavirus.
We have to be extremely careful. The difficult thing with this virus is that you might be carrying it, you might be passing on to others without really very high symptoms. So that's when, we have to be a bit more responsible.
In the wake of growing novel coronavirus cases in the country, the Health and Family Welfare Ministry has issued several advisories for the people to contain the spread of COVID-19. These advisories stress on several preventive measures like social distancing, personal hygiene and restriction of mass gatherings. A report.
People should avoid participating in large gatherings. If a person is experiencing cough and fever, he or she should avoid close contact with others. People are advised not to touch their eyes, nose and mouth without cleaning their hands. Spitting in public places should be avoided. All persons should practice frequent hand washing with soap and water or use alcohol-based hand rub. In case of fever, difficulty in breathing and cough, a doctor should be consulted immediately. Swati Rakheja, News Desk.
People who do not have ration cards in the national capital can now avail free ration from fair price shops in the wake of ongoing nationwide lockdown. These individuals are required to get registered by filling up a simple online form on Delhi government's official website to reap the benefit of the scheme. This was stated by Delhi Chief Minister Arvind Kejriwal in a digital press conference in New Delhi today. He said 71 lakh ration card holders are already receiving free ration and 6.5 lakh who have applied for the ration card but have not received the cards yet can also avail free ration. Mr. Kejriwal said ration may be distributed to them from next Thursday. Talking about the current status of COVID infection, Mr. Kejriwal said 59 new confirmed cases of coronavirus have been reported, taking the tally to 445 in the city. 6 patients have died. He said 40 individuals were infected by local transmission and rest of the cases are either of workers or people having foreign travel history. Mr. Kejriwal said these 40 cases indicate that there is no community transmission in the national capital.
In Himachal Pradesh, effective steps are being taken to ensure adequate supply of fodder and feed in the state. In the wake of the curfew due to COVID-19 pandemic, the state government is also ensuring that there should be no scarcity of pesticides, fertilizers and other plant protection material for the growers of the state. A report.
The State Horticulture Department has been asked to ensure door-to-door supply of pesticides and other plant protection materials to the horticulturists. On the other hand, a smooth supply chain of fodder is being maintained in the state and the officers has been asked to monitor the situation on regular basis. Chief Minister Jairam Thakur also directed the officers to expedite the supply of anti-hail nets from Gujarat so that it could be made available to the horticulturists well in time. Meanwhile, state government today sanctioned 1 crore rupees for the purchase of PPE kits and N95 masks for police personnel of the state in the wake of COVID-19 pandemic. Sanjeev Sundariyal, AIR News, Shimla.
In Madhya Pradesh, 2 more coronavirus deaths were reported in the state today, taking the toll to 11. 5 more coronavirus cases were detected, 3 in Indore and 2 in Khargone, taking the state count to 160. Our correspondent has filed this report.
In a video message, Shankaracharya Swami Swarupanand Saraswati of Jyotish and Dwarka Peeth has appealed to the people to fully support the administration.
तो जो कोरोना से संकटग्रस्त हो गए हैं, उनका संसर्ग बचाते हुए और यदि वो अपने भीतर आ गया है तो दूसरों से संसर्ग नहीं करना चाहिए और जो लोग नियम का कानून का उल्लंघन कर रहे हैं तो ये सर्वथा अनुचित है.
At the same time, the Catholic Bishop of Jabalpur, Gerald Almeida, said that religion can be followed only when we will alive.
चर्च, मंदिर, मस्जिद, गुरुद्वारा वहाँ ना जाए, अपने घर में दुआ करें, प्रार्थना करें.
The Chief Minister urged the religious leader to cooperate in making the call of Prime Minister Narendra Modi successful by lighting lamps, candles, mobile flashlights at 9 p.m. tomorrow. The religious leaders have appealed to the people to celebrate upcoming festivals like Mahavir Jayanti, Good Friday and Shab-e-Barat inside their homes. Sanjeev Sharma, AIR News, Bhopal.
11 more COVID-19 positive cases were confirmed in Kerala today, taking the total number of presently infected patients to 254 in the state. A report.
State Health Minister K.K. Shailaja informed that out of the newly confirmed cases, 5 people returned from Dubai and 3 had attended the Nizamuddin religious meeting. A total of 306 COVID-19 positive cases were reported in Kerala. Out of that, 50 people recovered so far. Presently, 254 people are being treated for COVID-19 in the state. More than 1,71,000 people are under observation, of which 734 people are in hospitals and the rest in home quarantine. Meanwhile, rapid testing for checking community transmission has been initiated in Kerala, in which result will be available in 2 to 3 hours. Mayusha for AR News from Thiruvananthapuram.
Karnataka Primary and Secondary Education Minister Suresh Kumar has said that 144 confirmed COVID-19 positive cases are reported as of now, including 4 deaths and 11 discharged in the state. 16 new cases were reported today. He said that 4th, a 75-year-old patient, was from Bagalkot who breathed his last due to the uncontrolled diabetes and hypertension. On Tablighi Jamaat visitors, he informed that 380 people have been identified in the state, 10 are from Indonesia and 9 from Kyrgyzstan. Till now, 214 test reports are received of such visitors, 16 are found positive and 198 have been found negative of the virus.
A Hyderabad-based vaccine company, Bharat Biotech, is hopeful of completing formalities soon and come out with a vaccine in the form of nasal drops for COVID-19 called Coroflu. Chairman and Managing Director Dr. Krishna Ella informed All India Radio that the research for a vaccine for COVID-19 is going on for the past 3 months and currently animal trials are underway. He said his company has capacity to manufacture 300 to 350 million doses along with other partner companies for its use in India. He said the Drug Controller General of India is being approached for obtaining approval.
In Tamil Nadu, shops selling essential commodities like groceries and meat have been asked to shut down after 1 p.m. every day. The move is aimed at further reducing people's movement outside their homes. Earlier, the retail traders were allowed to run their businesses till 2:30 p.m. Today, 74 people tested positive for the COVID-19, taking the toll to 485 cases. Meanwhile, 2 COVID-19 patients lost their battle against the disease in the state this morning. With this, the death toll due to the disease in the state has risen to 3, while 6 have been discharged from hospitals after cure. Our correspondent has more updates about the situation in the state.
The Chennai Corporation has employed an additional 16,000 people on contract basis to implement the COVID-19 containment plan. Wearing basic personal protective equipment, they have been asked to visit about 10 lakh households in identified areas in the city to screen the public for any symptoms for the disease from tomorrow. Meanwhile, works of disinfecting public buildings and open spaces are continuing on a war footing. Today, the fire and rescue personnel were engaged in a massive fumigation exercise in more than 4,500 taller public buildings using fire tenders across the state. Jai Singh, AIR News, Chennai.
To tap the menace of fake news in the Andaman and Nicobar Islands, a detection team has been formed to monitor and report any suspected incident occurring as a result of spreading of fake news. The public may call on numbers provided and report any fake news instances. The team, comprising 4 members, shall keep track of all print, electronic and social media on a regular basis and report any instance of fake news. The instances of fake news detected will then be forwarded to the concerned authorities, who shall take action under various penal provisions of IPC and Disaster Management Act 2005.
Assam Chief Secretary Sanjay Krishna has said that the state has enough food stock for rice in Food Corporation of India, FCI. Talking to AIR News, Mr. Krishna said that 10,000 metric ton pulses is expected to reach the state in 1 week. He said that government has also found out from open market that rice is available for 10 days. He assured that district administration is taking care of migrant workers. The Chief Secretary also said that government has identified medical colleges and hospitals for COVID-19 patients. He said that around 72,000 people have been put on home quarantine. The Chief Secretary said that necessary PPE and triple-layer masks have been given to various people. Mr. Krishna said that steps have been taken to prevent circulation of fake news. He warned that strict action will be taken against those who circulate fake and provocative news.
The first batch of medical supplies from the Centre to Strengthen Sikkim's healthcare system to tackle COVID-19 arrived today at Libing Helipad in Gangtok. Principal Secretary of State Health Department K. Srinivasulu said the medical consignment delivered by the central government included personal protection equipment, masks and disposable gowns. He informed that a flu testing lab will be established in the state within 3 months with the help of the centre.
In Manipur, a 23-year-old woman with overseas travel history who had earlier tested positive for novel coronavirus and became the first COVID-19 patient in the state has reported negative for the virus. The first COVID-19 positive case of Manipur was confirmed on 24th of last month. She is getting treatment at Jawaharlal Institute of Medical Sciences, JNIMS, Imphal.
The Mizoram government has launched a mobile application to provide its users all necessary and correct information in the fight against COVID-19. While launching the app, named as M-COVID-19, State ICT Minister Robert Romavia Roite said the app will give a big help to the state-level task force, Departments of Health and Family Welfare, Disaster Management and Rehabilitation, and also the general public to contain the spread of the coronavirus.
Amidst coronavirus outbreak, actor Zareen Khan encouraged fellow citizens to stay home.
मैं आज आप सबसे ये रिक्वेस्ट करने आई हूँ कि प्लीज अपने अपने घरों में ही रहें और इस मुश्किल घड़ी में देश को कोरोना वायरस से जूझने में मदद करें। प्लीज घर से बाहर ना जाएं, क्योंकि ऐसा करके आप न सिर्फ अपनी जान को बल्कि अपने आसपास वालों, अपने घर वालों और अपने देश वालों की जान को भी जोखिम में डाल रहे हैं।
Actor Himani Shivpuri appealed to the people to come together in the fight against COVID-19.
आज मैं आपसे एक अनुरोध करने आई कि कृपया आप अपने घर में रहें और सुरक्षित रहें और हमारी सरकार जो भी लॉकडाउन के नियम बना रही है उनका पालन करें। जितने भी कोरोना वायरस के वॉरियर्स हैं, हमारे डॉक्टर्स, नर्सेज, पुलिस कर्मचारी और जितने भी प्रशासनिक अधिकारी हैं वो अपना काम बहुत अच्छे से कर रहे हैं।
The News Services Division of All India Radio in its bilingual live phone-in program tonight will bring you a special discussion program on COVID-19. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards.
3 new novel coronavirus cases have been confirmed in Nepal. According to the Ministry of Health and Population, a 21-year-old male from Kelali district who had returned from Mumbai and a 41-year-old male from Kanchanpur district who had returned from Uttarakhand have tested positive. A 34-year-old woman from Kelali district has also been infected by the virus. She is said to be a relative of one of the earlier COVID-19 patients from the district. This is the first locally transmitted case of coronavirus in the Himalayan nation. So far, 9 positive cases have been reported in Nepal, out of which 8 are active, while one person who was diagnosed in January has recovered.
The World Food Programme, WFP, has said that rapidly growing novel coronavirus pandemic is so far having little impact on the global food supply chain, but that could change for the worse if major food importers remain anxious. The UN agency said global markets for basic cereals are well supplied and prices are generally low. WFP senior spokesperson Elizabeth Byers said disruptions are so far minimal, food supply is adequate and markets are relatively stable, noting that global cereal stocks are at comfortable levels. The outlook for wheat and other staple crops is positive for the rest of the year. However, given the highly globalized nature of food production and supply, commodities need to move from the world's breadbaskets to where they are consumed, and the novel coronavirus-related containment measures are starting to make this more challenging.
Spain recorded a second successfully daily drop in coronavirus-related deaths with 809 fatalities. The total number of deaths in Spain now stands at 11,744, second only to Italy. The number of new cases also slowed at 7,026, taking the total to 1,24,736. Recoveries over the last 24 hours stood at 3,706, taking the total to 34,219. The Madrid region was the worst affected, accounting for 40% of the deaths.
U.S. President Donald Trump has expanded the role of the U.S. Army in the fight against novel coronavirus, saying no one is better prepared to fight the current situation, which is like a war. Mr. Trump described New York as the hotspot of this war. The number of those infected by COVID-19 in New York State alone crossed 100,000 and the deaths touched 3,000 yesterday.
Hockey India today donated an additional 75 lakh rupees towards the PM CARES Fund to tackle COVID-19 pandemic in the country, taking its total contribution to 1 crore rupees. Hockey India on 1st of this month had donated 25 lakh rupees towards the cause. The decision to donate an additional 75 lakh rupees was taken by the Hockey India Executive Board.
And now, before we end, the headlines once again. Prime Minister Narendra Modi reviews countrywide preparedness to deal with COVID-19, directs officials to ensure sufficient availability of essential medical equipment. Prime Minister holds telephonic conversation with US President Donald Trump. Two leaders agreed to deploy full strength of India-US partnership to fight novel coronavirus. Government releases first installment of 11,092 crore rupees under State Disaster Response Fund to combat COVID-19. Health Minister Dr. Harshvardhan urges people not to create hindrances in duties performed by healthcare professionals. And Power Ministry clarifies adequate arrangements in place to handle grid stability during Lights Out event tomorrow. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. With that, we end the special news program on COVID-19.